The question is that this bill be now read a second time, and I call the Honourable Member for Sydney.
Thank you, Mr Deputy Speaker. When I was first elected to the Parliament, the leader of the Labor Party was Kim Beazley. Kim's very well known to my friend sitting here, Gary Gray, and he's very well known to members of this Parliament as an erudite man, a compassionate man, a great lover of American history, and for his great good humour. But there's another thing about Kim Beazley. He had polio as a child. That's how recently this disease, which is now unknown in Australia and is on its way to being eliminated worldwide, stalked the Australian community. Our current ambassador to the United States was one of its victims. Kim said that he never forgot the day he woke up just 5 years old, unable to move. He said, "I don't think contemporary Australians can comprehend the fear that ran through our community at the thought of polio," he said in an interview in 2004. I can't imagine that fear that that little boy felt, but I can certainly imagine the fear of his mother. I think any parent can. And I can imagine it, but neither I nor any parent in Australia today will ever need to feel it, because we have eradicated polio in Australia and will eradicate it within coming years around the world. Polio was beaten in Australia by vaccination. In Australia, in North America, in Europe, and soon in the whole of the rest of the world. We see resistant pockets in Pakistan and Afghanistan, but I'm confident that the huge steps that those countries have made, even in the last year, will see us really tackle this disease fully. Vaccination is one of the single most effective and cheapest ways we have of keeping a community healthy. And the example of polio, and of course of smallpox before it, shows that with proper eradication campaigns we can eliminate many of these diseases, and we can certainly save many lives. Vaccination is the reason that measles deaths around the world have declined from 2.6 million in 1980, which of course to us just sounds like yesterday, doesn't it, 1980? 2.6 million people in 1980, mostly young children, died from measles. They declined to just over 145,000 in 2012. If you put measles with diphtheria, rubella, polio, whooping cough and all of the rest of these diseases between 2000 and 2013, vaccination saved an estimated 15.6 million lives. Smallpox has been eradicated. As I said, polio cases have dropped from the hundreds of thousands in the late 1980s to a few dozen. Around the world, around 3 million lives every year are saved by vaccination, and for each of those lives saved, there are others that are spared lifelong disability from the complications of these diseases. Labor has a very strong record on immunisation policy. Raising the rates of immunisation was a priority for me when I was a health minister. It was a priority for Nicola Roxon before me. And I know that, of course, it's a priority for the current health minister and for our next health minister, Catherine King. In her capacity as the Shadow Minister for Health, she spoke very movingly last week about meeting two sets of parents, Tony and David McCaffrey and Catherine and Greg Hughes, who had tragically lost their children to the easily preventable disease of whooping cough. Having worked as a director in the Commonwealth Department of Health and Aged Care, Catherine really understands the policy issues around health and community health. But I could tell, more importantly than just this systemic understanding, that her conversations with these parents who have lost so much and given so much to the campaign in favour of immunisation have become such targets in some cases of the horrible internet trolls. She was moved not just as a health administrator but as a parent, and I'm sure that she will take up this case as Health Minister. In 1993, our national immunisation strategy brought consistency to vaccine schedules and vaccine pricing. We introduced the Australian Childhood Immunisation Register, announced in the 1995 and 96 Keating budget. We supported the expansion of the Australian Childhood Immunisation Register to become the Australian Immunisation Register, and the expansion of the National Human Papillomavirus Vaccination Program Register to the Australian School Vaccination Register, capturing a greater range of vaccinations. While I was Health Minister, we added several new vaccines to the schedule, including the combination measles, mumps, rubella and varicella vaccine called the MMRV vaccine, and a combined meningococcal C HIB vaccine. And of course we also did Gardasil for boys. Just as we were the first nation internationally to do Gardasil for girls, we were the first to do Gardasil for boys, because boys of course are also vulnerable to HPV and also of course vulnerable to the cancers that can result. We made important changes to family payments to lift immunisation rates, including linking the family tax benefit end-of-year supplement to immunisation. We worked with states to raise vaccine awareness and on successful strategies like requiring a child's ACIR record for school enrolment to identify children who had slipped through the immunisation net or have not yet fully met the immunisation milestones. This accompanied by the very good work, innovative work of our Medicare locals, helped increase the coverage rate amongst 5-year-olds from 83% to 90% during our time in office. In fact, in just 1 year, from 2011-12 to 2012-13, the percentage of 5-year-olds fully immunised rose in the Lower Murray region from 86.2% to 93.9%. In Broken Hill in the far west, from 89.1% to 95.6%, a stunning result. And in Kempsey Nambucca, from 84.6% to 91.1%, all three marvellous results. But we know that in some communities, children are still at risk. In that same year, in 2012-13, 13 out of 61 Medicare local catchments had less than 90% of 5-year-olds fully immunised. The lowest rate, and I'm really quite ashamed to say this, Mr Deputy Speaker, was in eastern Sydney at 86.2%, an area, of course, that is home for me. For the last year, in my own state of New South Wales, the Northern New South Wales Local Health District at the other end of my state recorded only 87.4% of children fully vaccinated. Some children, of course, miss vaccination because their parents have forgotten, their parents don't know fully about the childhood illnesses that their children should be immunised against. Their parents have lost track. I mean, there are a number of different reasons that parents have missed out on the information communicated to them. Perhaps it's even in a language that they don't understand. So it is important to invest in reminders, in education programs, in community awareness raising, and making the point to individual parents through reminders and to our broader community about the benefits of vaccination. But there are cases, of course, where parents deliberately refuse to vaccinate their children. They prefer to rely on the rumour mill of the internet rather than take medical advice. I say to those parents, talk to your GP. As a parent, I took the advice of my doctor, and all of my children are fully immunised. As a health minister, I took the advice of medical professionals, and I prioritised raising immunisation rates as one of the best and most effective health interventions we can make as a nation. The number of children whose parents or guardians lodged what some people call a conscientious objection to vaccination has risen from 0.23% in 1999 to 1.77% at the end of last year. I have said many times, and it disappoints me that I still see this language used sometimes, that the term conscientious objector is completely inappropriate for people who refuse to vaccinate their children. They are not Quakers carrying stretchers under fire from the battlefield back to the trenches during World War I. These are people that are deliberately refusing to vaccinate their children, to protect their own children and our community against these illnesses. I think it's important to note that no major religion has a prohibition on immunisation. This is a decision that parents are making based on misinformation, dangerous misinformation from the internet. They are vaccine refusers. Vaccine refusers think they know better than doctors and scientists, and in doing so they put the health of their own children at risk, and they put at risk the health of other kids. Babies who are too young to be fully immunised, older people whose natural immunity has broken down with age, people who are sick with immunodeficient type illnesses who cannot be vaccinated. We need, for the protection of our whole community, the majority of people to be vaccinated where they can be. I think it's very important to say that we are supporting the no jab, no pay policy introduced in this legislation. And we certainly said before the 2013 election that we would move further in this direction, and we're pleased to see our policy reflected in this bill. It ends the vaccine refuser exemption, and it makes sure that only those with legitimate medical reasons to not vaccinate their children can access childcare benefit, childcare rebate or the family tax benefit Part A supplement. Of course, one of the most important things that we learn in managing our vast and vastly successful health system is that prevention is better than cure, and that certainly is the case when it comes to vaccines. Thank you.